It depends. A bunion is a progressive deviation that takes several years to manifest. The speed and severity of this deformity depends on many genetic, environmental factors, your physical activity, and the type of footwear that you use. This deviation of the bone of the first metatarsal creates, at the level of the joint of the big toe, a potential for the formation of arthritic disease which can develop if not treated. When the first metatarsal deviates medially, the big toe does the opposite and deviates laterally. This means that the part of the medial cartilage of the head of the metatarsal is no longer used and will eventually atrophy and disappear over time. The greater the deviation, the greater the atrophied joint surface. This is called joint adaptation. So the sooner the deformity is addressed, the less this adaptation will be problematic. The other problem encountered if this deviation is not treated is at the level of the sesamoids, which are these small bones under the joint. With the deviation of the first metatarsal, these sesamoids are dislocated and will eventually create significant joint damage at the plantar level of the joint over time. A little like badly aligned kneecaps, causing friction and pain at the level of the knees, which one calls chondromalacia. Symptoms are frequently intra-articular pain after physical activity or intra-articular crepitation with the movement of the big toe. The frequency or the intensity of these signs is an indication that surgical correction is required. So the ideal time to operate a hallux valgus would be as soon as these affectations begin to decrease your quality of life and before arthritic changes occur. Weight-bearing foot x-rays are usually sufficient for an assessment of the condition of the deformity and that of the joint. Serial radiographs can be compared to old ones to assess the rate and progression of this deformity.